Hello everybody, it's been a while I have done a video. Recently I met one of the student who was in my study group. He did not purchase my courses or anything like that. He said he would like to meet me. I said that's fine, no problem. He lives in the same town as me. So I met him at a coffee shop and he failed his clinical exam. You all know that in the recent clinical exam only 2 doctors passed the clinical exam out of 34. This is the shocking result I've ever seen in the AMC clinical history. So he failed in the exam as well. And I was asking him what are all the things he struggled with. He said, you need to help me. I said, that's fine, no problem. But I wanted to know, why he failed. So I was asking him to tell me what are all the scenarios he had some problem. So he was asking a doubt about examination. Okay, so if you are in the exam situation, there are 2 scenarios coming to the examination as such. The first scenario is where you will ask the examiner for findings, and the second scenario is you have to examine the patient. So he asked me a very good doubt. I had the same doubt when I was preparing for my clinical exam as well. So this doctor failed this exam because what he was doing is he was washing his hands for each and every scenario with the soap, as per the WHO washing guidelines, which will take 1 to 2 minutes. Then he was drying his hand, even in the scenario that says ask the examiner for findings. See, some of you guys might do the same mistake. So I'm doing this video to help you guys. Scenario 1, where the scenario says ask the examiner for findings, you don't need to wash your hands. If you want to tell the examiner that you would like to wash your hands, you can tell the examiner, doctor, before I examine my patient, I would like to wash my hands. Could you please tell me the findings of examination? Or could you please tell me the vitals of my patient? So that's scenario 1, where you are asking the examiner for findings. Scenario 2 is where you have to examine the patient. For example, if the scenario says examine the cranial nerves of this patient, or if the scenario says examine the abdomen of this patient, or if the scenario says perform a CVS examination on this patient, which is cardiovascular. Okay, so in such scenarios where you are going to touch the patient, you have to wash your hands. If you don't wash your hands, you will be in trouble. So make sure you wash your hands when you're touching the patient. That's scenario 2. In scenario 1, where you are asking the examiner for findings, you don't need to wash your hands, but you can tell the examiner, doctor, before I examine my patient, I would like to wash my hands. Could you please tell me the vitals of my patient? Or could you please tell me the inspection findings on abdomen? So I hope you got what I'm telling here. See, don't waste your time like this doctor because he wasted 1 to 2 minutes of his exam time. This mistake I've explained is a very small mistake this doctor has done. But I've noted down 7 mistakes he has done, and I can tell you most of you will do the same 7 mistakes. So in order to help you guys, I'm doing a webinar, which is a free webinar where you all can come live on the call. I will be teaching here and you can listen to what I'm teaching, and you can ask me questions as well. And I'm going to do this webinar in the next few days. If you click the link either above this video or below this video, or look at the comments, the first comment, I will post the link to the webinar. So click the link and register for the webinar. It's a free webinar again. And again, I can only teach 200 students on the webinar. So be quick and make sure you invite your study partners and role players as well, because some of the mistakes you need your study partners or role players to be aware of as well, because if they're doing the mistake or if you're doing the mistake, both of you will not be benefited. So make sure under the comments you invite all your friends and study partners who are preparing for the clinical exam, so they will also register for the webinar. and I will be sending you the link of the webinar to your email. So make sure you register for the webinar by clicking the link either above this video or below this video, and make sure you check your email and click the link in your email, because I'm going to send the webinar link to your email. All you need to do is, once I send the webinar link, you will click the link and you can listen to what I'm telling, and I will send you the details of the webinar, the date, time, everything in the emails I'm going to send you in the next few days. So if you want to learn these 7 big mistakes done by this doctor, you need to register for this webinar and hurry up. There are only 200 spots. I can't teach for more than 200 people on this webinar. So make sure you register immediately. You invite your friends as well, so that they will be benefited also. And I wish you all the best. I'll see you soon on the webinar in the next few days.